Meet Sarah. Sarah is a nurse that just started working at a new hospital. Since she's new, the hospital where Sarah works will spend almost $50,000 to train her on their devices and procedures. But there's a big problem. With the growing number of medical devices, new therapies, and extremely complicated EHR systems at the hospital, it's almost impossible for Sarah to remember all of the training. What's worse, if she makes a mistake, it can be very expensive for the hospital. According to a recent U.S. report, preventable medical errors are responsible for over 10,000 serious complications a day, which results in over 440,000 deaths a year. But what if Sarah had some help? What if, instead of just relying on her memory, Sarah could simply point her smartphone at any medical device before starting a procedure and watch a quick video that reinforces the classroom training she had already taken? That's where we come in. We're Tiny Health, and we attach short, easy-to-view videos to medical devices so that nurses like Sarah can watch quick training information before starting a procedure. This type of education, viewed just before Sarah starts a procedure, is known as just-in-time training, and our platform simply and easily integrates into Sarah's workflow at the hospital. With Tiny, Sarah has the help she needs to provide better care. Every time she starts a procedure, it's a chance for her to be retrained. And because she's making fewer mistakes, it means improved patient safety and fewer hospital-acquired conditions. Not only that, but with Tiny, Sarah feels more confident in performing procedures and using therapies. The best part about Tiny is that it's not only easy for nurses like Sarah to use, but it's also extremely easy to set up. To start using Tiny, a short training video is linked to a scannable Tiny Smart Sticker via Tiny's administration dashboard. That smart sticker is then placed on a corresponding medical device. Before starting a procedure, Sarah can then scan the smart sticker on that medical device using her smartphone or a hospital-provided tablet. As soon as she scans the smart sticker with the Tiny app on her phone, she'll see a short training video that reinforces the classroom training she's already taken. Every scan is recorded for compliance and analytics, so hospital administration can track exactly when Sarah watched a video and if she viewed the entire training. Just-in-time training can be extremely effective in reducing errors with high-risk, low-use devices, especially where nurses don't use a certain medical device for months at a time. Tiny can also help nurses like Sarah reduce errors in EHR documentation, where the workflow for correctly documenting a procedure is complicated and often difficult to remember. In fact, in a recent pilot with 75 nurses, Tiny reduced the documentation error rate for a procedure at a major magnet hospital by over 50% in just 6 weeks. With Tiny, your hospital can start to reduce error rates and increase the consistency of care, while quickly remediating staff mistakes and increasing the confidence of nurses like Sarah to handle different procedures. Please contact us at tinyhealth.com so we can discuss how Tiny can help reduce errors at your organization while giving your nurses the confidence to truly provide exemplary care.